Hi everyone, I'm Vanessa from Smileyscope and I'm going to run through a little bit of background on the Smileyscope and then we're going to go into some hands-on education as well. The Smileyscope was actually developed in Melbourne by a doctor working in paediatrics, and her co-founder is an adult respiratory physician. He was seeing some patients avoiding return to healthcare due to needle anxiety and the potential of getting a blood test, and Evelyn was seeing a lot of this little face, which I'm sure you're all very familiar with. And the statistics there are quite alarming on how many patients are needle anxious. And so what Evelyn and Paul did was a big deep dive into improving procedural pain management. And one of the things that stood out was how well virtual reality can reduce procedural pain. So if you have a look at these two MRIs, they're functional MRIs. Both patients, they're receiving the same pain stimuli with VR and without VR. And you can see that the brain pain centers light up quite differently with those patients. With our therapy mode, as you can see the little fish there, the therapy mode is the choreographed program that we have developed for patients undergoing needle procedures. And the reason we have gone with the fish theme, which is where your patients are going to see a little fish nibbling around on their arms or the procedure site that you have selected, is Evelyn asked about 100 of her patients where they would rather be than in that room with her, and if they could escape into a different world. And the overwhelming majority of patients said at the beach in the water swimming with the fish, and that the fish could be the little poke part of the needle procedure. So that is what we now have. So how the Smileyscope works is you select one of the many programs that we have now, and there's something to really cater towards all different patient cohorts, different patient ages, and different procedures that you're going to be doing with your patient. And then you start progressing that on the patient through the different programs, and ideally receiving the better clinical outcomes that you're going to see. So reducing pain, anxiety, need for medication, and increasing overall satisfaction. What makes the Smileyscope unique is that it has been made by clinicians for clinicians, and it's medical grade hardware. So it's not something that you can just grab off the shelf and download with games and everything like that. It is all medical grade hardware and software that's been specifically designed for the medical setting. It's all wipe downable with any of the antibacterial wipes in the hospitals between patients, and it's been clinically validated in one of the world's largest pediatric VR trials as well. So what we know is how the Smileyscope works in neuromodulation, and it's really targeting that threat, pain, anxiety axis and regulating behavior, because the patient's going to be getting a much better experience with the VR. And what we see here is the different procedure sites that you can select in the therapy mode. So if you're doing port access, you might choose the chest. If you're in the immunization clinic doing some vaccines, and go for shoulder, and then so on and so on. And that's where the fish will be hovering over, and the virtual body part that the patient will see. And when we go under the water, the patient will be guided to look at the fish in front of them and then look towards their arm, for example. And you can really engage a patient at this point too. So asking how many fish they can see on their arm, and you'll be able to hear all of these audible cues at the same time. So that's where you follow along with the program with your patient, and you can get them engaged and choreographed into that therapy mode. So getting them to say, hey, how many fish nibbling on your arm? And at the same time, you'll be hearing Pogwood's the penguin, who is their little guide, saying, you might feel some little nibbles or pokes because the fish really like you, and that's your cue to be doing your needle procedure at that stage. It doesn't matter too much if you're not precise at that point, because you do have a fair bit of flexibility with the fish moving around on the patient's arm, and that's why we also have different lengths of procedure time as well. So we've got a rapid and 1 minute, which you'll generally use for an IM or IV removal, then 3 minute, which you'll generally use for an IV, and then the 7 minutes. So 7 minute you would use for port access or a trickier IV cannulation. You can also use it for things like laceration repair, sutures, removing splinters, all of those types of things too. So, and skin pricks, you name it, you can start using it. The key is introducing it to a patient early in their procedure, and you might want to choose off with one of the relax programs as well. So getting them introduced to the Smileyscope, how it feels, how it looks, how it sounds, and then moving into the therapy mode. So going back to that clinical trial that was done, this was done in the emergency department and pathology units at the Royal Children's and Monash Children's Hospitals here in Victoria, and it was standard of care versus standard of care with Smileyscope. And this was with our very first program. So the graphics have improved a lot, as has the headset. But even back then, you can see those reductions in pain, anxiety, need for restraint. And the big one was the reduction in caregiver rated distress, which was down 75% as well. So that's a huge reduction. And we love a bit of contagious calm. So now this little guy, he was only 3, and I used the breathing program for him, and he was having a quite decent burns dressing done in an outpatient setting. And as you can see, he's comfort positioned on mum's lap, moving all around, trying to catch the bubbles, trying to catch the fish, but not a care in the world about what was going on with his arm. So that's a good indication of where you can use it in the younger patients. The therapy mode is for 4 and up. So we do have lots of different programs to choose from. The breathing program is great when you need a patient to be still or doing a regular breathing pattern. So you can use that one with any of your nebulizers or with nitrous or gas down in theatre. It's also good if you need a patient to be still, because they just follow that dot that shrinks and expands in time with them being told, now breathe in and breathe out and let everything go and relax. And all of the ocean life and bubbles come around and swim across in front of them. We also have our MRI familiarisation program. Now, the Smileyscope can't go into the MRI, but it can be used to prepare a patient for an MRI. So we do have an MRI familiarisation program, but you can also use the therapy mode if you need to cannulate a patient pre-MRI. There's also meditation programs. There's 4 guided meditations. The 2 ones at the top, the Relaxing Garden, is a really beautiful one, and takes patients through a full body relaxation and teaches them skills like how to do box breathing. Then you've got the Forest of Serenity, which is voiced over by the lovely Sir David Attenborough, and that's a gorgeous walk through the rainforest, and there's some really nice pain management techniques in there that they can learn. And there's also the relaxation content. With the meditations, the 2 at the bottom, the beach and the river, were actually developed with clinicians in mind for you guys to use when you've had a really crappy day and you just need time out. Take the Smileyscope, sit somewhere nice and quiet for 10 minutes, and that is your time to do some downtime and relaxing. And then the relaxation content, there's a whole suite of programs in there that you can use to introduce the Smileyscope to a patient. You can use it during dressing changes or nasogastrics, or when a patient's long term and is just sick of being in that bed on the ward. You can let them choose all of the relaxation content. You can also use it after a program. There's some patients who might want to watch what you're doing, so in that case you might use the relaxation program before, give them the choice to watch the therapy mode, and then they might want to watch the relaxation again after they've had their procedure, so that their last memory is their best memory. So how do I use the Smileyscope? First, we turn it on with the red button at the top, and that will bring up this menu for you. And then you just press the little icon and then the bigger icon to take you into those different programs. The earlier you can introduce it to a patient before you know that they need a procedure done, the better, so that you're not putting it on an already escalating patient, because no one wants something put on their eyes when they're already in a escalated state. So then we are introducing it to our patient, even engaging the parent if they're the anxious one in the room. So I've often let the caregiver watch it first and then hand it over to the patient. So that's a nice option too. So choose your age group. There's different language options in that top right corner as well. And then choose the length of program. Make sure your volume's turned up and hit next. It'll take you to the procedure choice page. And then you'll get to this blue page where it says press the green button 3 times to get started. But don't do that until it is back onto the headset. So press it, pop it back onto the headset. It's just held on by magnet and onto the patient. And then pressing your green button 3 times to get started. You can take this strap off or just hold it up if a patient has bulky hair, doesn't like anything on top of their head, or you might be doing, say, a back of the head laceration or back of ear laceration repair. You've got the options to chop and change it. Otherwise, it's just a matter of adjusting the head strap to fit the patient. It does work with glasses. So we go headset first, then strap on, and to remove, strap off, and then the headset off as well. And just make sure that you're charging it up as needed so that your next colleague doesn't get a flat device, and the charging port is just in there and the charger is in the box.
Over the next few minutes, I'd like to show you how to use Smileyscope. Before we get started, let me show you Smileyscope's medical-grade virtual reality headset. It's lightweight, can be used on patients ages 4 years and up, and has an antimicrobial impregnation. Smileyscope consists of 2 parts: the headset that the patient wears and the removable front display where you control the experience. Smileyscope is easy to use. Just remember these 4 steps. 1. Set up the experience. 2. Introduce the set to the patient. 3. Triple-click to start. 4. Wipe down and recharge. First, let's set up the experience. Clean the headset with any hospital-grade antimicrobial wipe. Remove the front display from the headset and turn it on by holding down the red button. Use the touchscreen to select the experience that best suits the patient's needs. There are several programs for you to choose from. For example, therapy includes choreographed virtual reality experiences designed to help manage pain and anxiety during medical procedures. Vaccine also includes a rapid version of the choreographed VR experience, tailored to vaccination procedures. Meditate includes guided mindfulness meditations that are ideal for adults. Breathe includes guided deep breathing exercises. Relax includes a variety of calming experiences, including swimming with seals and sitting in a room full of kittens. There are additional programs including an MRI familiarization tool that enables patients to experience an MRI simulation in virtual reality. Ask your Smileyscope representative about new products and updates. Let's select Therapy Mode. Select Get Started. Select the appropriate age group for your patient: child, teen, or adult. For a child, you also have the option of showing a preparation video, which explains the medical procedure and how virtual reality can help. Select the appropriate length. Rapid and short are between 45 seconds to 1 minute, which works well for vaccinations. Medium is 3 minutes, which works well for blood tests. Long is 7 minutes, and often used for procedures like IV cannulation and port access. You can adjust the volume using the slider. You can also select a different language by selecting the language icon at the top of the screen. Press Next. You may be asked to select the procedure site. For example, for a blood draw, select Arm, then press Start. Reconnect the display to the headset. The next step is the most important. We're going to introduce Smileyscope to the patient. The more comfortable they are using the technology, the better their experience. Smileyscope works by letting patients go on an underwater virtual reality adventure. While patients are having their procedure, The virtual reality world matches the real-world sensation of the procedure. You might like to introduce Smileyscope as diving goggles. You can find ideas on how to engage patients in the Tips and Tricks video. Ensure the patient is in a comfortable position. Smileyscope will work for any patient orientation, for example, sitting upright or lying down. Place the headset on and adjust the strap to ensure it fits comfortably. Patients with glasses do not need to remove them to use Smileyscope. Place the headset directly onto their face over their glasses, and then slip on the headband. To start the experience, press the green play button 3 times. Only press the green button 3 times when the faceplate is connected to the headset and on the patient's head. This will ensure the VR experience is in the direction they are facing. You'll hear a chime that confirms the experience has started. You'll be able to hear the verbal cues, such as "look at the fish," as fish come in to nibble when the needle is being inserted. If the procedure takes longer than expected, the virtual reality experience will simply loop until you have finished. When you're done, carefully remove the device. Wipe down the headset and recharge. Thanks for watching and enjoy using Smileyscope. To see how you can get more out of Smileyscope, visit our website at smileyscope.com.
So that's a little in-service that you can watch, but these are all of the different areas that the Smileyscope is used in. So many different areas now. Something that started just from blood draws and IVs is now used across the board. So a patient can start using it in the emergency department. They might be where they get their first IV, or they might need a dressing done. Then they might head to the ward, need IV antibiotics, or go to theatre and be gassed down, or IV anaesthetic, and then return to the ward and then head to outpatients once they've had their cast on for a few weeks, and then come back for a cast removal, and they can use the Smileyscope there as well. And because we have so many different programs in there now, they can watch something different all along the way. So you've got lots of different options to choose from, and I've used this from ages 3 all the way up to geriatrics. So it's not something that's very limited. There is a couple of patients to avoid using it on though, and those are patients with epilepsy or who are with programmable shunts, and that's because there's magnets in the headset and it can't go into the MRI, of course, either. So we do just wipe it down between patients with the antimicrobials, but the grey foam in here is impregnated with antimicrobials, and it's a closed cell foam. It is all medical grade hardware, so you just wipe it all down in between patients and make sure that it's not left unattended in a room where it can potentially be walked out and taken home by somebody. I recommend signing it out, signing it in, and keeping it in a room where it can be swipe access only. And the best thing you can do to keep the Smileyscope, or if you're doing a trial, is to fill out the surveys that we provide. So when we get them back, we can put them together in a data chart for you and be able to present that back to the financial stakeholders in the Smileyscope, and then you can see for yourselves as well how much it does improve patient experiences as well as caregiver experiences. I hope that was very helpful for you. You can always contact everyone at Smileyscope for any questions that you may have, and there's lots of frequently asked question information on our pages that come in the box, but you can also always get in contact with us, and there's lots of information on the website. Hope you're well, stay well. Thank you.